Did you know that what many call harmless snoring can strain the heart and raise the risk of stroke? I'm Dr. Alina Serratia, and today I'm speaking to adults over 60 who wake tired, snore loudly, or notice a racing heartbeat at night. Recent research reveals that repeated pauses in breathing during sleep are not just annoying. They can reduce oxygen, trigger stress hormones, and place real pressure on the heart and blood vessels. Stay with me, because by the end, I'll show you the warning signs, the bedtime habits that worsen it, and the safest steps that can protect your brain and heart. If this sounds like you, comment sleep and say whether you wake refreshed or exhausted. I will be replying to each one. Many families never connect a nighttime breathing problem with heart attack, stroke, memory loss, or collapse. They think the person simply snores, sleeps lightly, or needs another pillow. But here's the shocking part. The body treats every breathing pause like an emergency, even when the sleeper has no idea. Here's what happens when the airway closes again and again during sleep. The throat narrows, air stops moving, oxygen drops, and the brain sends out alarm signals. The body releases stress chemicals to force breathing to restart. That can push blood pressure higher and keep the heart from getting the recovery it needs. Think of revving a car engine over and over while it sits in the driveway. Research shows sleep apnea has been linked to higher rates of high blood pressure, stroke, coronary artery disease, and heart failure. The hidden danger is that many older adults do not feel choking or panic. They may notice dry mouth, morning headaches, poor memory, or a noon nap. Studies found older adults are often high risk and still undiagnosed. An American Academy of Sleep Medicine Foundation report using Medicare survey data found 56% of adults age 65 and older were at high risk for obstructive sleep apnea, yet only 8% had been tested. But here's the shocking part. This common condition can still hide in a quiet bedroom. Let me tell you about George. He was 72, stubborn, funny, and sure his wife was exaggerating about his snoring. At first, he complained about a dull headache and feeling tired after breakfast. He blamed age, the weather, and his medicine. He never blamed his breathing. Over the next year, George started falling asleep in his chair by mid-morning. He stopped walking with his neighbor because he felt weak. His wife noticed long, silent pauses between snores, then a loud gasp. He tried herbal tea, a softer mattress, and early bedtimes. Nothing helped. Fatigue made him irritable, forgetful, and worried. Then his daughter recorded one of those gasping episodes on her phone and brought it to his doctor. George resisted a sleep study because he thought machines were only for severe cases. Still, he agreed after learning that untreated sleep apnea is associated with heart rhythm problems, stroke, and worsening blood pressure. He finally decided to find out what was happening instead of guessing. Within 2 weeks of being evaluated, George learned he had obstructive sleep apnea, meaning his throat kept collapsing during sleep. Within 6 weeks of using treatment and sleeping off his back, he said his morning headaches were almost gone. He could finish a neighborhood walk again. His wife slept better. Comment headache if you wake with that heavy morning pressure. And tell me your age. Now let's amplify the problem, because the next part will surprise you. Sleep should be when blood vessels relax and the heart gets a break. When breathing keeps stopping, that repair time gets interrupted. Research shows some estimates suggest 1 billion adults worldwide have sleep apnea. A 2025 review reported that obstructive sleep apnea appears in about 40 to 80% of patients seen in heart clinics with hypertension, heart failure, coronary artery disease, atrial fibrillation, or stroke. In simple terms, this problem keeps showing up where heart disease lives. Here's what happens when low oxygen and repeated arousals become a nightly pattern. Blood vessels become less flexible. Inflammation rises. Platelets, which help blood clot, may become stickier. The heart has to pump against more pressure. But here's the shocking part. Many people think danger exists only by day, while damage builds at night for months or years. Some research suggests every increase in sleep apnea severity brings higher cardiovascular risk, so early action matters. This can affect independence too. Poor sleep leads to slower thinking, lower balance, low mood, and less energy to cook, shop, exercise, or take medicines on time. Then they spread into other problems. Weight often rises, blood sugar gets harder to manage, blood pressure becomes less predictable. Partners move to another room. Families worry, but do not know why. Comment tired if you sleep a full night and still feel worn out the next day. I read every comment because signs matter. Let me tell you about Linda. She was 68 and already treated for high blood pressure. She did everything right. She took her medicine, kept her follow-up visits, and watched her salt. Yet she woke with pounding in her chest around 3 in the morning. Her doctor adjusted medications twice, but the nighttime surges kept returning. Linda grew afraid of bedtime. She started checking her pulse before sleep, and again when she woke. Her daughter noticed her memory slipping during conversations. She had trouble finding words and felt ashamed. She even stopped volunteering at church because she could not trust her mind. The toll was deep. She told me, "I feel like I'm fighting something I cannot see." Her clue came from a simple question. Did she snore? And did anyone ever hear her stop breathing? Her sister said yes immediately. Linda had never connected snoring with her racing heart. She agreed to testing, and she also began cutting out wine in the evening. She was skeptical that ordinary habits could matter, but she was willing to try. Within 1 month, Linda reported fewer nighttime pounding episodes and steadier mornings. Her home blood pressure readings became less erratic. She felt calmer because she finally had an explanation. Research from Johns Hopkins and the American Heart Association supports the bigger picture. Poor sleep and untreated sleep apnea are linked with hypertension, arrhythmia, stroke, and heart failure. Stay with me, because what many seniors do before bed can make the cycle worse. The first thing to avoid is alcohol close to bedtime. Here's what happens when you drink in the evening thinking it will help. Alcohol relaxes throat muscles, which can make the airway collapse more easily. It can also change how the nervous system controls heart rate during the night. A 2021 laboratory study in healthy adults found that evening alcohol raised nighttime heart rate and reduced heart rate variability. That means the body does not settle as well. But here's the hidden disaster. Many people feel sleepy after alcohol and assume that means better rest. It often means lighter, disrupted sleep later at night. That becomes especially dangerous for seniors who already snore or gasp. I remember a patient named Patrick, age 75, who thought his nightly drink was helping him relax. After he stopped alcohol within 4 hours of bed, his wife noticed fewer loud gasps within days. Comment I'm guilty if this one sounds familiar. Don't worry, you're about to learn how to fix it. The second thing to avoid is sleeping flat on your back if you snore or have known sleep apnea. Here's what happens when gravity pulls the tongue and soft tissues backward. The airway narrows more easily, and breathing events can increase. The American Heart Association reported in 2025 that most people with sleep apnea have much worse symptoms on their back than on their side. What they don't tell you is that back sleeping can turn a manageable problem into a heavier oxygen drain. But here's the shocking part most people don't know. Some people have what doctors call positional sleep apnea, meaning the problem becomes much worse mainly in one position. A 2025 positional therapy review described studies where a vibrating device reduced apnea events from 25 to 13.7 per hour in 1 week for selected patients. That does not replace medical care. Work for everyone, try and ye a word. Still Still, it shows how one sleeping habit can matter. The third thing to avoid is using sleeping pills or anti-anxiety medicines without asking if they may worsen your breathing. Here's what happens when certain sedating drugs relax the body too much. They can deepen sleep in a way that makes the airway more likely to close and can leave you even sleepier the next day. Mayo Clinic warns that alcohol, some anti-anxiety medicines, and some sleeping pills can worsen obstructive sleep apnea and sleepiness. Most seniors don't know that the very thing meant to help may worsen the root problem. The fourth thing to avoid is ignoring the signs because you think snoring is normal with age. Here's what happens when warning signs go untreated year after year. Blood pressure often stays harder to control. The heart may face repeated surges of strain. Memory, mood, and daytime safety can decline. Let me tell you about Martin. He was 81 and insisted he was just getting older. After a near fall in his kitchen and repeated daytime dozing, he finally got checked. He told me later he wished he had listened years earlier. Now let's turn to what you can do, because the next one will surprise you. Number 5 is simple but strong. Stop alcohol at least 4 hours before bed, and discuss sedating medicines with your clinician before making changes. Do you know what happens when you remove a bedtime relaxant that is relaxing the throat too much? Breathing often becomes more stable, and the heart gets a better chance to settle. Some people notice fewer awakenings, less dry mouth, and less pounding in the chest. The benefits reach further than most people expect. You may lower airway collapse, reduce stress bursts, improve sleep, and feel clearer next morning. It works like removing a heavy foot from a garden hose, so air can move with less resistance. Research shows the 2021 alcohol study found dose-related increases in nighttime heart rate and reduced calming nervous system activity after evening drinking. Mayo Clinic also advises avoiding alcohol and certain sedatives in obstructive sleep apnea. That makes this a smart first step. In practice, I tell my patients to move any alcohol to earlier social times or skip it entirely when sleep symptoms are active. Never stop a prescribed sedative on your own, but ask whether a safer plan exists. Many people notice the first changes quickly, sometimes within a few nights. Comment no drinks if you would be willing to test this for 1 week. Small experiments teach a lot. Number 4 is side sleeping instead of back sleeping, especially if you snore, gasp, or know you have sleep apnea. Here's what happens when you shift off your back. Gravity works less against the throat, so the airway may stay more open. The body has to fight less to pull in air. That means fewer alarms, fewer oxygen dips, and a quieter night for you and your partner. This can bring several benefits at once. It may reduce snoring, lessen breathing interruptions, decrease dry mouth, and improve morning energy. It is low cost, and it starts tonight. Research shows a 2025 review of positional therapy found short-term adherence rates of 76 to 96% with modern devices in selected patients. The same review reported one trial where mean apnea events dropped from 25 to 13.7 per hour. But here's the shocking part. Positional therapy works best for the right person, not everyone, so evaluation still matters. Try a pillow behind your back, a body pillow, or a wedge to stay on your side. Some people do well with a positional reminder device. If shoulder pain makes side sleeping hard, alternate sides and support your knees. Improvement can happen in days, especially in snoring and restlessness. Before I reveal the number 1 solution, which of these surprised you most? Comment below. Let me tell you about Elaine. She was 74 and hated the idea that something as basic as sleep position mattered. She thought sleeping that way sounded too simple to help. Still, her husband said her loudest choking sounds always happened when she rolled onto her back. She began using a body pillow and a soft belt that reminded her to turn. Within 10 days, her husband noticed longer, quiet stretches and fewer frightening gasps. Elaine said she stopped waking with a racing heart. She was not cured, and she still needed proper care, but that change helped her feel safer while she pursued full treatment. Pillows do not perform miracles. Small nighttime mechanics can matter more than people realize. Number 3 is protect your airflow before sleep. Do you know what happens when your nose is blocked by congestion, allergies, or dry air? You may breathe through the mouth, and that can worsen snoring and airway instability in some people. Mayo Clinic recommends keeping nasal passages open, and Johns Hopkins suggests reducing dust and other bedroom triggers. Here's what happens when breathing through the where the nose improves. Air moves more smoothly, the mouth dries less, and sleep may fragment less. The benefits here are practical. You may fall asleep easier, snore less, wake less thirsty, and feel more comfortable using other treatments. Studies and expert guidance support saline spray, cleaner bedding, and better allergy control. In practice, wash bedding weekly, vacuum dust regularly, and ask your clinician which allergy treatment is safest for you. Expect subtle changes within days, not months. Comment stuffy nose if this is part of your nightly struggle. Number 2 is get evaluated early if you snore loudly, stop breathing, wake choking, or stay exhausted despite enough time in bed. Here's what happens when you stop guessing and measure the problem. You move from fear to facts. You learn whether the issue is mild, moderate, or severe. You also discover which treatment fits your body. That is powerful because the right plan depends on the true cause. Research shows early recognition matters. The Medicare-based older adult data I mentioned found that 56% of adults age 65 and older were at high risk for sleep apnea, while only 8% had been tested. That gap means many people may be walking around with a treatable problem and never know it. A sleep study may happen at home or in a lab, depending on your needs. The test is not punishment. It gives information. I tell patients to ask themselves 4 questions. Do I snore loudly? Has anyone seen me stop breathing? Do I wake with headaches, dry mouth, or choking? Am I sleepy, foggy, or irritable during the day? If the answer is yes to more than one, tell your doctor. You may notice relief even before treatment begins, simply because the fear of the unknown lifts once you have a clear plan. Number 1 is use your prescribed treatment consistently, not only on good nights. Here's what happens when sleep apnea treatment works. Breathing stays more steady. Oxygen falls less often. The heart faces fewer emergency surges. Sleep becomes more restorative instead of broken. For many people, that treatment is PAP, or positive airway pressure. Others may use an oral appliance, weight loss treatment, or another plan chosen by their clinician. The benefits can be life-changing. People often report less daytime sleepiness, fewer morning headaches, better focus, and less blood pressure strain. Research shows a 2024 JAMA Network Open study followed 835 Medicare beneficiaries with obstructive sleep apnea, with a median age of 73. Those who started PAP had lower all-cause mortality and lower major cardiovascular event risk than those who did not. PAP use was also associated with lower heart attack, heart failure, and stroke risk. That is large-scale, real-world evidence. A separate 2025 Mass General Brigham analysis of 3,549 adults found that CPAP users with certain risk markers had a 17% lower risk of cardiovascular death, stroke, or heart attack over roughly 3 years. In some subgroups, the risk reduction was even larger. But here's the shocking part. Treatment helps only when it is used. Skipping nights is like wearing reading glasses only sometimes and expecting clear vision all week. Use the treatment exactly as instructed. If the mask leaks, the mouth gets dry, or pressure feels strange, speak up early. Problems can often be fixed with a different mask, added moisture, pressure, adjustment, or practice. Let me tell you about Susan. She was 66 and almost gave up after 3 nights because the mask felt strange. We adjusted the fit, added humidity, and coached her through the first 2 weeks. Within 1 month, Susan said the fog in her head had lifted. She stopped dozing after lunch. She felt steady enough to drive longer distances again. Her husband said the bedroom finally sounded calm. Her story matters because improvement often comes in stages. First, the mornings feel better, then the afternoons, then confidence returns. Comment checking in if you have ever quit a treatment too early and wish you had more support. Here's what makes this powerful. These steps do not compete with each other. They stack. When you avoid alcohol late, sleep on your side, clear your nose, get tested, and use treatment consistently, you reduce strain from several directions at once. That creates a multiplying effect. The airway stays calmer, oxygen stays steadier, and the heart gets more real recovery. A simple routine can look like this. At breakfast, eat oatmeal, berries, and yogurt. Then take a daytime walk to support weight and sleep rhythm. At lunch, choose lean protein, vegetables, and water instead of saving drinks for evening. At dinner, finish earlier, keep the meal lighter, rinse the nose with saline if needed. Set up your side sleeping support and use your treatment at bedtime. Here's what happens when a routine becomes automatic. Health stops, depending only on willpower. None of this means every snorer will have a heart attack or stroke, and none of it replaces medical care. Some people need special caution. If you have severe lung disease, heart failure, central sleep apnea, recent stroke, or use opioid pain medicine, you need individualized advice. Always consult your healthcare provider if you notice loud choking, blue lips, chest pain, fainting, or extreme daytime sleepiness. Those signs need prompt attention. If you wear dentures, have jaw pain, chronic nasal blockage, or feel claustrophobic in a mask, tell your clinician. There are options. If you already take sleeping pills, anti-anxiety medicine, or nighttime pain medicine, ask whether those could worsen breathing before making any changes. Responsible care is not fear, it is protection. Comment Doctor Talk if you plan to raise this at your next visit. You now have the knowledge many people wish they had years earlier. The main problem is not just bedroom noise. It is repeated breathing collapse that may strain the heart, raise blood pressure, and increase stroke risk over time. The good news is that the key solutions are simple, practical, and treatable. You do not have to accept exhaustion, morning headaches, or frightening gasps as a normal part of aging. This is in your control more than you may think. Start with one step tonight, then build from there. Comment one of 3 things. Tested if you are ready to ask about a sleep study, side sleeper if you will change position tonight, or no drinks if you will protect the hours before sleep. If you want more plain language videos that help protect your brain, heart, and independence after 60, subscribe. In my next video, I'll show you evening signs that blood pressure is damaging your kidneys before you feel it. If this video helped you, share it with someone who needs to hear this. You might save their life. Take this seriously, but take it with hope. Tonight is a good night to begin. I'm Dr. Alina Serratia, and I'll see you in the next one.